Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics and emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Pontiac. The theme of our health talk today is breast cancer awareness. Joining us today as our guest speaker is Dr. Savitha Balaraman. She is a medical oncologist. She is going to talk about what are the early symptoms of breast cancer, how diagnosis is made, and on. So, good morning, Savitha, and welcome to my show.
Good morning, Dr. Prasad.
I am so privileged to have you because Breast Cancer Awareness Month was couple of months ago. I could not get anybody. But anyway, we will have a fresh start, right? Before we get started, can you give your introduction to our viewers?
Sure. I'm Savitha Balaraman. I'm a medical oncologist with Michigan Healthcare Professionals. In the cancer treatment journey, there are surgeons who are surgical oncologists, radiation oncologists, medical oncologists, radiologists, and pathologists who form the core of the multidisciplinary team. As a medical oncologist, I'm a part of this core team treating cancer patients with medications, be it chemotherapy, pills, hormonal therapy, or targeted therapy.
So that's good to know. You're covering the medical part of it. So will you let our viewers know what could be the early symptoms of breast cancer, how they will approach? First of all, they are primary care physicians, and then they will refer you to you.
So the first thing I would like to say is breast cancer can be without any symptoms, and mammograms are the key for diagnosis of early precancerous lesions, non-invasive lesions, and cancerous lesions. But if a person does a regular breast exam and notices any change in the breast, they should take it to the attention of their primary care physician. Some of the key abnormalities that they may notice are a lump in the breast, a change in the symmetry of the breast, any nipple discharge, any skin irritation or skin retraction or dimpling. One of the most often misdiagnosed cases of breast cancer is if they have pain in the breast. A lot of women think that is not associated with breast cancer. That is not true. There is a specific kind of breast cancer called inflammatory breast cancer that can present with redness, pain, engorgement, a feeling of heaviness, almost like an infection, and many times it may not be associated with a mass. So any change in the breast that is new needs to be taken to the attention of their primary care physician.
So for our viewers to know, these are the early symptoms that will draw attention, so they will seek help from their primary physician. And then later on, can you tell us about the age group? Because we have been seeing this thing happening in younger and younger age group these days, which is very scary.
Typically, breast cancer was thought to be a disease of women 50 and above.
Right.
But today, as you mentioned very rightly, we are seeing a lot of younger women. Now, the reason for that is not very clear all the time. Most breast cancers happen in women without a family history. So that is another very key aspect to this. Young women who feel an abnormality often may ignore it, thinking, oh, I don't have a family history. But family history is only one of the very small components or causes of breast cancer. So today, any age group of women who have any abnormality in the breast need to be checked out immediately.
So then, in other words, genes don't play a significant role here, right?
Genes do in about 10 to 25% of
that's
cases.
When I was doing research study, about 10 to 20% only the genes play. So now they go to their physicians, and what are the regular diagnostic studies that should be done before they come to you?
In addition to a breast exam, and
Yeah.
an examination under the armpit, because sometimes breast cancer can present as a lump under the armpit,
yeah.
which is a lymph node very often. The physician will order a mammogram and an ultrasound. Now, if they notice that the abnormality is seen on the mammogram and the ultrasound, then a biopsy is ordered. In some cases, an MRI of the breast may be ordered. I would like to make note here that even in a patient with a normal mammogram, there can be breast cancer hidden. So just because you have a normal mammogram, do not ignore a mass or an abnormality in the breast.
Yeah, that is very important key point to note. And even if you have a normal mammogram, still, there could be a possibility. And of course, painless and painful, you already told the pain will be more if it is an inflammatory kind of thing. So now the diagnosis is made. So what are we going to do? Before we do that, can you also tell us about the men and women? I know some men also get involved.
So the breast cancer can also happen in males.
Yeah.
Typically, even if there's one male family member with breast cancer, we recommend genetic testing because it is very rare, but it can happen. So men who have lumps in their breast or breast enlargement or breast discomfort need to have that attended to by their primary care physician. Usually it's on one breast rather than both breasts, so that needs to be addressed with their primary care physician immediately.
And one of the significant clinical findings I have noticed from all this experience of working in different field of medicine, is a nipple discharge, which in men I'm talking about, which makes them suspicious that something is happening.
Correct.
So men and women, okay. So now what are we going to do about once the diagnosis is made? And I know there are different kinds of pathologic diagnosis, ductal carcinoma, ductal or the intralobular. Could you just comment on them for our viewers?
Absolutely. So when the diagnosis is made, the diagnosis rests on the pathology, which means they have a biopsy of the suspicious area. The biopsy may show a precancerous high-risk lesion. It may show a non-invasive cancer where the cancer has been detected before it broke through certain tissue barriers. And then it could also be invasive cancer.
Okay.
What
intraductal?
Intraductal versus invasive. Intraductal is non-invasive. You can also have non-invasive lobular cancer. So what non-invasive means is the cancer has not broken through the tissue planes, and that is a good stage to be diagnosed because in those patients we do not need chemotherapy. That is a non-invasive cancer which has been detected at stage 0, if you will. And it often can be treated with either medications or surgery with short courses of radiation with just pills.
Okay, the non-invasive ones. But if it is invasive with the metastasis like 3rd or 4th stage, then definitely chemo and...
So when you talk about invasive cancer, today we have come very far in the treatment of invasive cancer. So depending on certain markers on the cancer, the estrogen sensitivity, whether they have an abnormal marker called HER2, a lot of cancers today, even in invasive cases, can be treated with surgery, radiation, and pills alone. Even stage 4 metastatic cancer, often if they are estrogen sensitive, does not require chemotherapy. And these are the new advancements in breast cancer.
I was amazed when I read through all those, advanced cancer, and you can still treat them. So that is very good to know all those things. Once they start the therapy, I'm talking about the intraductal right now, later on I'll go to lobular. How long do you think that therapy will last, and when do you follow up on them?
So typically when we talk about therapy, we're talking about, in the case of non-invasive ductal or intraductal, they do something called excision or a partial mastectomy. Only
Yeah.
the portion where the cancer or precancer is present is removed. They typically do not need a mastectomy in most
Complete,
cases,
right.
which is also another advancement. With intraductal carcinoma, we don't need to even sample the lymph node because typically
Okay.
it does not spread to the lymph node.
Right.
After the patient has a lumpectomy, they may require a short course of radiation, and then if their hormone, if they are estrogen sensitive, we
Yeah.
put them on an anti-estrogen treatment.
Yeah.
It is a pill once a day for 5 years. Follow-up typically is every 6 to 12 months.
Yeah.
Follow-up includes a breast exam. They get annual mammograms, and we monitor them to see how they're tolerating these
Right,
pills.
yeah. But now we are going to talk about the invasive one, the lobulars.
So you could
And
have
if they have metastasis in the axilla, unfortunate but very sad.
So with invasive cancers, you can have invasive ductal as well as invasive lobular.
Okay.
Typically, invasive lobular is highly sensitive to anti-estrogen therapy.
Okay.
So early tumors are treated again with a lumpectomy. But in the case of invasive cancers, we also sample a few lymph nodes under the armpit or the axilla, because by definition, invasive means they have broken through the tissue barriers
Right, yeah.
and entered into the breast tissue and have the ability to spread into the bloodstream or the lymphatic system. The good news, however, even with patients who have cancer metastasized to the lymph node, many of them do not require chemotherapy today.
Oh,
And
they're-
if they do need chemo, we can tell them
Yeah.
why they need chemo and
Yeah.
what is the percentage benefit of chemotherapy. So we're again into what's called precision medicine, where we can test their tumor and test multiple genes in the tumor
Yeah.
and determine the risk of recurrence and whether they would benefit from chemotherapy. Most estrogen positive women today, over 75 to 80% of estrogen positive cancers do not require chemotherapy.
Which is good to know. Oxygen, yeah, estrogen positive, yeah.
Yes.
So that the hormones play a significant role regarding the advances in the cancer, right?
Correct. And that's why we recommend breastfeeding, which seems to be preventive.
Yeah.
We also recommend that women who are going on hormone replacement therapy
Yeah.
after menopause talk to their doctors about breast cancer risk, including understanding their family history, because
Yeah,
a
of
strong
course.
family history may deter a primary care physician from giving a patient hormone replacement therapy after menopause.
Yeah, and I know, a couple of our friends, their family, they do have a history of breast cancer in the family, like mother, grandmother.
So it is very important to understand your family history of not just breast cancer, because
Yeah.
breast cancer can be associated with many other cancers.
Right.
Most common are ovarian, prostate, pancreatic,
Yeah.
melanoma. So understanding the full spectrum, and then today we can test their saliva or their blood
Yeah,
to see if they have genetic mutations.
that was very interesting when I read about this, check the saliva.
There are lots of genetic clinics that are available
Genetic clinics.
that
yeah.
go through your family history, and then they're able to determine what are the tests they need to do. Because if we do find out that you have a gene, then
Yeah.
in addition to a mammogram, we may offer an MRI every
Yes,
year,
yes.
and we may be able to put you on some medications to prevent cancer. So there's
Yeah.
early detection, prevention, and your family may benefit from it as well.
Yeah. Now this genetic therapy, this saliva detection will it go for the ovarian cancer also?
Yes, absolutely. Even one family member with ovarian cancer,
Ovarian cancer.
we recommend that they meet with a genetic counselor
Yeah.
and undergo genetic testing.
Yeah, which is very important, just early diagnosis is so important, right? Yeah.
Early diagnosis translates to increased cure rates. As
Increased
simple as
cure.
that.
Right, yeah. The maximum survival rate would be how much would you say?
So today, because of all the advancements, we say stage 1, 2, and 3 breast cancers are curable, not just treatable.
Yeah.
With stage
curable.
4, there are so many advancements today
Yeah.
that each type of breast cancer has a different rate of survival. So what I would encourage women is breast cancer or any cancer today has so many new therapeutic advances that talk to your doctor, have them sequence the tumor, because we can now sequence their tumor and treat medications that affect their cancer rather than using population statistics.
Yeah, which is so important. Though. So many experimental things, researches are going on, and overall, the prognosis will be getting better and better, right?
It has already gotten better, but we only expect more to come for the better.
Right, yeah. So then, we have a diagnosis. So now tell us about the preventative aspect, which is so important. My health talk is always, I emphasize on the preventative aspects of medicine, whether it is pediatrics, whether it is emergency medicine and all those. So how do our population, how do we prevent, what preventative measures we take?
I think the old dictum of prevention is better than cure applies most to cancer.
Right.
So the things we can do ourselves as women, and obviously men as well, would be to exercise regularly to maintain good body weight, eat healthy. There is now mounting evidence of increased alcohol consumption being associated with an increased risk of breast cancer in women. So moderating alcohol intake is going to be key. Understanding family history, because family history in those 15 to 20% of patients who are at increased risk may help us prevent cancers or diagnose them early. And the last but not the least is making sure regular examinations by your physician of the breast and annual mammograms. I can never ever undermine the benefit of both of these, because with mammograms, like I said, we could detect high-risk lesions before they develop into cancer.
Yeah. Now, one more thing. Is there any correlation with smoking or diabetes?
So it's not so much with diabetes as with metabolic syndromes. So metabolic syndromes, as you know, is a person who has potentially diabetes, hypercholesterolemia, high body mass index. So high body mass index and fat content has been associated with an increased incidence of breast cancer, hence the emphasis on exercise. It is not so much the weight, it is the muscle to fat ratio. There is also data in women with estrogen sensitive breast cancer that if they exercise regularly and convert the fat cells into muscle, that decreases the production of estrogen and decreases their risk of recurrence.
Yeah, so exercise, for our viewers, exercise plays a significant role, improves the circulation of the body and maintains the weight, and also extra weight like obesity.
Absolutely, and exercise has long-reaching effects. It's not just cancer, not just breast cancer. There are so many other cancers that are associated with a poor lifestyle. The other research that has come about is about intake of sugary drinks, about focusing.
You know what? Afterwards, I'm going to do a senior citizen health safety, and I read all those, researches. They said that beer, the drinks,
alcoholic drinks,
they play a significant role,
in cancer. Absolutely,
in cancer, right?
And it is speculated. In fact, there was a study, I believe, from Brown University that talked about poor diet, low grain intake, high sugary drink intake, high alcohol intake, low vegetable and fruit intake directly being correlated with breast cancer in the younger population. Maybe poor lifestyle is one of the reasons why we're seeing a lot of younger population.
Younger people, because they go to the college and they get involved eating junky food and all that. The processed foods in these days, they have a very high link to all those things. You agree with me, right?
Yes. So again, eating healthy food and a well-balanced diet and exercising can be key to prevention of a lot of disorders.
A lot of this.
And starts young.
Yeah, right. Yeah. So that was very interesting to go through all those articles that have come out from Massachusetts, from other area, and the cancer.com, they have a lot of it, yeah.
Yes.
So that's very good to know about this. So anything else do you want to talk about?
So I think you brought up a very key point, the resources that are available on the
Right,
internet.
yeah.
There are some resources that you can rely on, and some of them I would recommend are cancer.gov, which is the
Yeah,
American
that's
Cancer
cancer.com,
Society.
yeah.
Absolutely. There is also another website for patients who've been diagnosed with cancer called the National Comprehensive Cancer Network,
Yeah.
which also publishes amazing data.
National Comprehensive, yeah, I went through that website.
Yes,
yeah.
and there's a very patient-friendly website with the NCCN
Yeah.
that talks about when a person is diagnosed, what are the next steps, and that allows patients to understand why their doctor is recommending certain treatments, and it is almost like getting a free second and third opinion that's
Right,
available
yeah,
just in your in your iPhone or your laptop.
Yeah, yeah, and it's very important because they can go through all those websites. These are the preventative aspects. Yeah,
The one thing I would also like to mention is because there has been an explosion of all the new drugs that are available for treatment.
yeah,
In the past, when we used the word clinical trials, people always thought, oh my God, I have no other options. That's
But,
why my doctor is referring me to a clinical trial.
Yeah.
And they thought that was the end of the game. That's no longer true.
yeah.
We are able to bring clinical trials earlier into our practices so our patients can get the advantage of getting these newer, better drugs early on in their
Right,
journey,
yeah.
which most often will translate to better overall survival, better quality of life,
Yeah.
etc.
There are a couple of those new drugs that I read about, but I thought we will save it for our next talk because that itself will be another talk. What are the experimental drugs and
The therapeutic advances, yes,
therapeutic advantages, drugs versus placebo.
absolutely.
So yeah, next within my next segment of health talk with Dr. Balaraman, will cover the experimental drugs that have been tried for the treatment of the cancer. So your last 1 minute, what would you say to our viewers?
What
Your
I would
last
s-
1 minute.
Okay, what I would say is ignorance is not bliss.
Right.
Knowledge is power, right? The health that we have today is a blessing, and we alone have the ability to control what we can do about it. Extraneous factors we can't,
No.
but keeping ourselves healthy, both physically, emotionally,
Physical.
and mentally, all of these are key components of a very healthy individual.
Healthy. And that's very good. So I like to thank our viewers today for watching me on my health talk. And the topic is breast cancer awareness with our medical oncologist, Dr. Savitha Balaraman. I like to thank our producer, our camera, for helping me produce this with wonderful tapes. And until I see you all, everybody, I wish all of you happy holidays and good winter safety. Thank you again.
Thank you again for having me on this show.
Yeah.